Hi, everyone. I'm Maggie McGrath, editor of ForbesWomen. There have been a bevy of abortion cases considered by courts across the country this week alone, with the Supreme Court declining to intervene in Texas's emergency abortion case, with a judge in North Dakota ruling that that state's abortion ban cannot stand while the state appeals a lower court's repeal of that ban, and a back and forth in an abortion ban in Georgia. And that's this week alone. It is confusing for doctors, it is confusing for patients, and it is confusing for some of the folks who are following the news. So joining me now is someone who can help break it down. Yeon Choimorrow is the executive director of the National Asian Pacific Women's Forum. Yeon, thank you so much for joining us.
Thank you for having me.
So I just rattled off a bevy of news that happened within reproductive health, reproductive justice this week alone. Can you talk about what you're hearing from your community and how confused they are by the back and forth in some states as lawyers battle out state-by-state abortion bans?
Yeah, as you said, it's been pretty confusing, the back and forth. And I will add that for our community, often there's an added barrier because folks who are recent immigrants to this country already have a language barrier they need to navigate and a healthcare system, even if it's not about reproductive health, right? That is pretty challenging to navigate. And so when you throw in legal obstacles or legal ping pong on top of that, it becomes almost impossible for folks to figure out what is going on. And so we do hear from and see members of our community being really concerned, especially women who are, fairly new to understanding the systems. I think people try to do the safest thing possible, right? Stay under the radar, that sort of thing. And, when you find yourself pregnant and, God forbid, you have complications and all of a sudden you're thrown into this legal battle where you're just trying to have a baby, but all of a sudden, you can't get treatment because it's considered illegal, right? So I think that's the bigger issue is when you think about it on the day to day, majority of our community members living in Texas or Georgia aren't sitting there reading the news every day about court cases, right? They're just going about their life, right? And, if a woman is experiencing a big pregnancy, they would expect the doctor to be able to treat her and save her life. And all of a sudden she runs into this barrier where it's like she doesn't understand why these things are happening. And if she's not a person of means, we'll be able to get to a hospital or medical care quickly enough to get treated. And I think that's what's most concerning for our community.
And in those cases, is someone connecting that patient to you and to your organization, or are they just getting lost in the system and your job is to advocate on behalf of all people?
Yeah, we don't work directly with individuals, but we work with organizations that serve AAPI women in different states. And many of the organizations work with survivors of gender-based violence or domestic violence. And we see these cases where women are not able to get the proper health care they need, whether it's abortion by choice or are going through pregnancy complications because hospitals are being extremely careful, right? And so we do the advocacy work more broadly from what we hear from our community advocates that work directly with individuals. But I think generally there is a sentiment of fear. Already, people find navigating the healthcare system in this country pretty challenging, right? Because linguistically, culturally, they're not familiar. And to add to that, if you're adding, something like a person who's trying to terminate a pregnancy because of abuse or because of other issues or just by choice, those things complicate their situation even more.
It strikes me that when we talk about reproductive health in America and maternal health, we often talk about the racial disparities in outcomes, right? We hear that women die at certain levels, but that is exacerbated among women of color. And we often say particularly Black women are affected by maternal mortality. And I feel like AAPI women don't always get their fair share of the conversation. So Sun Young, I'm wondering, can you address what our audience needs to know about AAPI women and reproductive health that isn't getting covered as much as it should be?
So as a matter of opinion, in this recent polling that we conducted, where we polled AAPI women who voted in the last presidential elections, over 76% said that they think that abortion should be kept legal, right? So as a matter of opinion, our community by and large supports a woman's right to choose whether to carry out a pregnancy or not. But when you talk about health outcomes and disparities, looking at the state of California, after Black women, Pacific Islander women have the highest percentage of maternal mortality, and nobody talks about it. And the reason being because Pacific Islanders are such a small number in terms of the broader population, they don't show up in data, right? And this is the biggest concern for AAPI women and our health outcomes is that one, we're not a monolith, and depending on what region of the world you come from, your health outcomes vary. And so if you take the populations and disaggregate them even further, we definitely don't show up in data because the numbers are so insignificant, right? So these things don't get addressed. Southeast Asian women also experience maternal health issues and maternal mortality at higher rates than other AAPI women. But again, because our data is all aggregated and these subgroups tend to be smaller in population than, let's say, the South Asian community or the East Asian community, it doesn't rise to the top of concern. And most public health departments and programs don't address these concerns.
Is that just in maternal health and reproductive health, or is this across healthcare as a whole, where the AAPI population is not perhaps getting its due consideration in the data and what the medical establishment is looking at?
Yeah, I mean, it's actually in all aspects of our lives, right? Like data collection and disaggregation of data is so important to be able to really understand what is going on in our community. And all sectors, including healthcare, does not collect enough data from our community to fully understand what is going on.
Interesting. Now, I want to go back to that polling number that you said 76% of the folks that you polled within your community say abortion should be legal in the United States. Is that correct?
That's correct.
What does that number say to you in this environment? We're less than a month out from an election. We have abortion ballot measures on certain state ballots in November. Talk to me about what this says to you about American sentiment about reproductive health access.
I think that AAPI women, along with many others living in this country, right, believe that women should have the right to choose. And I think the way this has been politicized and played out in the media and through this election, where it's really polarized, is not actually an accurate picture of what's happening in our daily lives. Most people want individual freedom. And that includes our ability to do what we want with our bodies, right? And so I think many people are thinking about this as they go into this election. Obviously, we care about a multitude of things, but the fact that so many overwhelmingly believe that this is just a fundamental right that we should have will probably play a role in this election and how they show up.
There was a report from Arizona's Grand Canyon Institute. It's a nonpartisan think tank only looking at Arizona, but it's interesting because they came out with a figure that says that Arizona alone stands to lose $3.4 billion under the state's current restrictive abortion policies, largely due to a loss in labor force participation among women between the ages of 15 and 44.
Mm-hmm.
I'm wondering, it's okay if you don't have the number right at the top of your head, but how much have you looked at labor force participation among AAPI women, the women in your community, and how abortion restrictions or reproductive health restrictions are affecting them?
Yeah, so I don't have specific data, but I can tell you that, I've heard stories of couples who have had multiple miscarriages who are waiting to move out of Texas before they try again, right? They have made the decision to leave Texas because they want to have children, right? So you're not just losing women out of the workforce, you're losing families, because it's not just women that individually decide that they're going to leave the state because of these restrictions. It's the families, right? And so I think the economic impact is pretty huge because people are making the decision to invest. So doctors, right? I mean, I don't know if you've heard, but there, so many gynecologists are or in training are not choosing to go to these states to do their internships and their residencies, right? So it is having a ripple effect on so many more things than just women in the labor force, because it is, it's a fundamental decision that we make in development through life, right? A person's desire to have children or not to have children is a very fundamental decision that everybody should be able to get to make. And they will choose to live where they can make those decisions.
I'm glad you mentioned the provider landscape because we interviewed Kate Ryder, the founder and CEO of Maven Clinic, a telehealth solution, earlier this week. And she told us that some 35% of counties in the U.S. do not have an OBGYN doctor in that county. And there's a different study in the JAMA Journal, Journal of the American Medical Association, indicating that OB-GYN residency applications have declined a little bit in states with abortion restrictions. So how much of your time do you spend talking to doctors, talking to providers, and solving for some of the gaps that are growing in the United States when it comes to maternal care?
Yeah, I mean, we don't spend a whole lot of time talking to providers, but this is a systemic issue, right? Like, it's not a matter of convincing more OB-GYN residents to voluntarily go to these counties, right? Like, you have to create an environment where people are going to want to go and work, right? And this is fundamentally the problem that we're facing as a country when we do these abortion bans state by state. I mean, you're creating entirely different worlds, right? So, for example, 5 years ago, I unfortunately had a very scary, life-threatening emergency where my ectopic pregnancy ruptured. I lost 2 liters of blood. And if it wasn't for living, 5 minutes from a hospital that has a very high-tech and very well-developed and informed OB-GYN team, I would have died, right? And so if you think about these counties, if I had lived in one of these counties, I would have died because there's no way they would have been able to operate and save my life quickly enough because of also the abortion ban, right? Like, technically the fetus is still alive. I'm dying, but the fetus is alive, right? And they would have to weigh these legal options, right? And so this is the biggest concern, I think. When you talk to doctors, they don't want to be put in situations where they can't make life-saving decisions that they have made an oath to do because of legal nonsense, being dictated by policymakers who are not medical experts, who are not, surgeons, who are not women themselves, right? So I think part of encouraging people to go into areas and really like having OBGYNs all over the country, you have to make an environment where they can actually do their work, right? I mean, it's got to be demoralizing to be working in these states where you know what you have to do to save somebody's life, yet you cannot because your hospital administration is telling you that you cannot, right? Like, nobody wants to be in that situation. So I think that's what we have to address more than anything else. There's no other way to get more doctors in these places until we change the law.
And to your point about changing the law, the perhaps silver lining here is that there are a number of abortion ballot measures that voters will vote on in November. We have ballot measures in Arizona, Colorado, Florida, Maryland, Missouri. I'm looking at a list here on the Kaiser Family Foundation. The list continues, and what each state is voting on is a little different. But Sun-Young, I'm wondering, can you talk about the importance of these ballot initiatives and what you're hearing from your community? I don't know if you have your eye on any one over another, but these seem like important measures to give people a voice in an area where I think since the Dobbs decision, a lot of people have felt voiceless.
Right. I mean, if you look at what happened last year with the ballot initiatives, we have heard loud and clear from the American public where they stand on this issue, right? Ohio, Kansas, right? Kentucky, all voted to preserve a person's right to choose when it comes to their reproductive health, right? So I think that continuing with these ballot initiatives are great and fine. But you know what? They're not going to help. You know who they're not going to help? They're not going to help folks like in Mississippi and Louisiana, where, you know, the disparities are the biggest and there's absolutely no political will, right? So this is why we need a federal solution, because if we have to wait for Mississippi, Louisiana, and these really, really conservative states to come around to protecting women's health, there's going to be a lot more women dying, and there's going to be a lot more doctor deserts in these places, especially reproductive health experts, right? And so we need a federal solution. And I think that, you know, the ballot measures are a great way to get people involved in a way to have a voice, because obviously things at the federal level can move a little bit slowly. But I am really hopeful that, you know, people are voicing their opinions. I know that, you know, we are working on getting voters out in Florida, and we are excited that people are thinking about reproductive health as an important issue. And there's this Amendment 4, right, to come out and vote for Amendment 4. And I am guessing this is the case in other states as well, that, you know, we need to give people something very concrete to make a decision on, because I think so far, for too long, this country's been immobilized and completely frozen in being able to make any big decisions, except for Supreme Court that keeps, you know, chipping away at our rights and creating it more difficult and more dangerous for people of reproductive health to have the access to healthcare that we need.
I hear you on the federal solution, and we'll come back to that in just a second. But you mentioned Florida, which of course has been devastated by Hurricane Milton, and right before that, Hurricane Helene. There's time for recovery a little bit before the election, but are you worried at all about your community's ability to access the polls and also, in the meantime, access care due to the damage from these tremendously strong storms?
Yeah, I mean, we're talking about reproductive health care. Let's be honest. People living in Florida have had difficulty accessing reproductive health care to begin with. So whether this storm or not, I think that's an ongoing challenge. I think that for our community specifically, you know, we work on getting voters information, because majority of the time in most states, they are not able to get information about the election in their language or really understand what's being sent to them or what the rules are. And so our job is to really help people understand how they can make their vote count and how their voice be heard. And so that's what we've been doing. And, you know, we're going to do our best. I mean, I think, you know, the one good thing is with technology, you know, we're not calling landlines anymore, right? There are cell phones, and there are ways to get our community information about any changes or any modifications that may happen due to infrastructure challenges to coming out to vote. And so we're hopeful that we're able to get people information as soon as, you know, there's updates in different county board of elections websites. We translate them, we reach out to our community and make sure they have the information. So we will continue to do our best to make sure that our folks have the information they need in the language that they understand, and really hope that folks will really engage, right? And sometimes I think that, you know, when you are going through something as challenging as a natural disaster, maybe it's an opportunity for us to think about how government really does matter and is important in our lives. And so I'm hoping that those folks that were planning to stay home and maybe not participate, thinking that, you know, politics is for other people and not for them, that they would think again and reconsider.
Oh, that's such an important measure. If you've been that's such an important message. If you think politics is for someone else and not for you, reconsider. I know I have to let you go, but quickly, you did mention a federal solution when it comes to reproductive health policy. And right now, in this structure of a patchwork environment, it's hard to imagine a federal solution. What would it take for that to happen?
Clearly, we've got to elect people that believe in people's right to choose how we want to have families or children, or if we do at all. And so I think doing the work to make sure that we are on the ground and making the message heard by all electeds, not just the ones that want to champion us, right? That accountability is really important. The people who are against us having the choice and opportunity to make decisions of our own body, hearing from us is just as important as having people who support our right to choose. And so we need to work on all angles to make sure we are able to get the votes. I think the other piece of it is that we really need to pay attention to how political the Supreme Court has become and is becoming, right? If you look at the decisions that have come out of this Supreme Court that was largely appointed by Donald Trump, it's not surprising, yet it's very alarming, right? That a branch of our government that's supposed to be neutral has become political. And so that's very concerning. And I think that people need to pay more attention to that as well, and see and learn lessons from what happens at the Supreme Court. We need to make sure it doesn't happen at the lower courts and at our state and local courts as well.
State and local elections are so important and do not get enough attention. So thank you for that point. And thank you so much for joining us, Sung-Young. We so appreciate your time and your insight. And we'll have to have you back as you continue to poll your community and do work on behalf of AAPI people.
Thank you so much for having me. Have a great day.